Hearing loss and hearing aids can be a scary subject for some people. There are a lot of questions that you need answered. What kind of hearing loss do I have? Is it treatable? Am I going to have to wear a hearing aid? What's the right hearing aid for me? We're about to answer these questions and many more in this short interactive educational video you won't want to miss. Welcome to It's Time to Hear, an interactive e-learning seminar on hearing loss and the most recent advancements in hearing aid technology. This seminar is sponsored by Starkey Hearing Technologies. Hearing loss explained. It's a question of quality of life. How you hear. To understand hearing loss, it is important to understand how the ear works. The human ear has three parts: the outer ear, the middle ear, and the inner ear. Sound, which is simply vibrating air, enters the ear canal and is funneled to the eardrum. The eardrum vibrates and causes tiny bones in the middle ear to move. These tiny bones amplify the sound vibrations and send them to your inner ear, or cochlea. Inside the cochlea, tiny hair cells activate, which in turn releases neurochemical signals. Your auditory nerve carries the electrical signals to the brain, which translates them into speech that you can understand. Hearing loss is more common than you think. According to the Journal of the American Medical Association, there are 26.7 million people in the United States over the age of 50 with significant hearing loss. Sadly, only 15% of those people who need help choose to wear hearing aids. From the moment we wake up to the time we go to sleep, sound plays an important role in our lives. Consequently, when we experience hearing problems and begin to lose this vital sense, we also begin to diminish our ability to be engaged, entertained, and informed. It's not uncommon to hear people who suffer from hearing impairment say it impacts their quality of life. There are many causes of hearing loss. The main ones include excessive noise, infections, genetics, birth defects, infections to the head or ear, aging, and reaction to drugs or cancer treatment. Changes in our hearing don't typically occur across the board or all at once. Rather, hearing loss symptoms appear over time. Hearing loss often starts off as a simple misunderstanding of certain words. Over time, you might start noticing more difficulty in noisy environments. Many times you start thinking that people are simply mumbling. When hearing loss starts to become noticeable, many people get frustrated with others easily. Many times in later stages of hearing loss, you start avoiding certain listening situations. Untreated hearing loss has been studied, and according to the Gerontological Society of America, those with hearing loss who do not seek help have a lower quality of life. The sooner we seek treatment for hearing problems, the more successful we'll be at slowing the negative social, psychological, cognitive, and health effects that come with it. So don't wait. Diagnosis of hearing loss. Do you really have a problem? Most of the time, hearing problems begin gradually, without discomfort or pain. What's more, family members often learn to adapt to someone's hearing loss without even realizing they're doing it. Here are some questions to ask yourself to determine whether hearing loss is present. Do I often ask people to repeat themselves? Do I have trouble following conversations with more than two people? Do I have difficulty hearing what is said unless I'm facing the speaker? Does it sound like other people are mumbling or slurring their words? Do I struggle to hear in crowded places like restaurants, malls, and meeting rooms? Do I have a hard time hearing women or children? Do I prefer the TV or radio volume louder than others? Do I experience ringing or buzzing in my ears? If you answered yes to several of these questions, chances are you do suffer from hearing loss and should schedule a hearing test from a hearing healthcare professional. When you arrive for your hearing test, you'll fill out a short survey about your hearing ability. Your hearing healthcare professional will perform a visual inspection of your ear canal to make sure there isn't wax or something else blocking your ear canal. You will then be placed in a sound-treated room and presented with speech and different frequencies of tones to discover two things. Number 1, is there a problem? And number 2, where is it? After the hearing test, the hearing healthcare professional will review your audiogram or graph of how you hear. There will be blue X's representing your left ear and red circles representing your right ear on the graph. If your X's and O's are within a certain area of the graph, you have normal hearing. Anything below that area is considered a hearing loss. Your speech testing and speech and noise testing results will be reviewed as well. If the hearing test determines that a medical issue is causing your hearing loss, you'll be referred to a physician. But if you're diagnosed with permanent hearing loss, hearing aids will be explored.